breast cancer was not on my agenda. Different cancer was always a problem in our house. My mom had bladder and kidney cancer. I didn't absorb it. And this was why having Carl with me was so important. He heard everything, and he listens very intently, and then we'd go home and we'd talk about it, and we'd cry about it, and it took a long time, because as you're sitting there and the doctors are telling you that you're going to have a mastectomy and that it's going to be good, and it's like, really? What part of this is going to be good, you know? And then the reminder that, you know, there's no chemo, there's no radiation, no hair loss, no anything else. So it's hard. It's a hard decision to make. Was it the right decision to make? Absolutely.
Every time a patient gets a new diagnosis of breast cancer, I have them come in to meet with me, and I give them a new patient binder, and I introduce them to all the services that our hospitals have to offer. And at that time, I usually have read their surgeon's notes and their medical oncologist notes, and we'll talk about what the patient is thinking, what the doctor has told them, and then I try to help them clarify what their goals are and what they would be more comfortable with. And generally, just try to lay the information out so the patient can make their best choice for themselves.
Deep flap breast reconstruction, it stands for deep inferior epigastric perforator flap. And essentially, it's a form of using the patient's own body's tissues to reconstruct their breast after having had a mastectomy. So what we wind up doing is we take the lower abdominal tissues and we actually detach it from the body. In certain cases in the past, what we used to do is we used to take some of the muscle with that tissue, but with this deep flap surgery, we preserve all of that muscle. We just trace the blood vessels down that are supplying and giving nutrition to the lower abdominal tissues, and we hook them up to the chest wall area, and that gives it its blood supply. But the biggest benefit of this type of procedure is the recovery time. Your recovery time is faster than with some other traditional surgeries using your own tissues. And actually there's some studies that show that compared to tissue expander breast reconstruction, which actually is basically a form of implant-based reconstruction, the pain is actually less in the recovery phase with deep flap reconstruction.
When I went in with Dr. Pathy, we first talked about implants on the first visit. And you could see his mind was working. And he said, you know, you might be a candidate for something else.
Certainly give our input as to what we think that a patient might be a good candidate for, but a patient could be a good candidate for multiple different things. And it is really up to you as a physician to really get on board with the patient, not just from the medical aspect, but from the social aspect as well.
One of the best parts about having patients come here is that we work as a really tight team with Dr. Karowski, the medical oncologists, Dr. Pathy, the staff at Same Day Surgery, our radiation therapy department. Everybody here plays a really important role, and we're very we work together really closely to help with the patients.
Very few places do it in Connecticut, and even nationally. It's not the norm to do it. I have to say that I'm very proud of Backus Hospital and the Hartford Healthcare Network for putting in the resources and building the infrastructure to allow us to do that. And they took a bit of a leap of faith to go ahead with this, but I think that we've seen quite a few rewards from doing so.